the Heaven Thursday edition with me, well. I'm not alone tonight. I'm joined by Dr. Philemon Nyambati from AIC Cure International Kijabe, and he is an orthopedic surgeon. He has been helping us to understand more about this disease known as Sever's disease, affecting mostly children aged between 8 and 14 years. And of course, those who are active in sports and all that, and even those who walk normally, they're not that active, but because of what the doctor reminded us, it can also affect all the other children. But there are ways of dealing with that, and that's what we were looking at in this hour. And so, Daktari, probably you could give us a bit of summary, especially when it comes to care for that child who has Sever's disease. The care given to them probably at home for somebody who didn't hear that at home, and then we will carry on. I have some few questions I needed to get clarification on.
Yes. So at home, we focus on limiting activity at that point, so that they hold off the competitive sport either a week or 2 weeks at least when they are having pain. And they have first also to make sure, if a child active, making sure that they are well hydrated, so that it's less risk of muscle injury and pain, and also having rest, ice, just to having a cold compress at the area where there's pain, and also just lifting or elevation, just helping with reducing that swelling that's at that point. Yes.
So for a child who has been diagnosed as to having this Sever's disease, how long can it take? Can it take the whole of their childhood, or for a period of time as it has been managed and treated? How long does it take for that child?
So until they reach skeletal maturity, there's a risk of recurrence. However, with at that point where they're having that pain, with actually good good rehab, what actually happens, and also strengthening and stretching of the area, they actually recover. So recovery is between from 2 weeks. Actually, they can recover, and people go back to normal life, or between two weeks to 2 months. They actually can go back to competitive sports. Yes. But the thing is, we advise, at least if it's the coach, whoever is teaching, or when you're beginning again, you have to actually condition the muscles, making sure you're well hydrated, making sure you stretch before exercise, or walking or running, and stretch after. Yes.
I also want to find out now, on behalf of a parent who is listening in, you said there is that moment of recovery, and we've said mostly for the children between 8 and 14. So somebody past the age of 15, probably at 15, 16, 17, thereabout, are they still likely to present with the symptoms of the same?
Yes, it's actually possible, because in boys, that growth plate closes at around 17. For girls, it closes around 15. So at that point also, they're at high likelihood. There are those also adolescents who mature later. And so it can actually happen up to 18. If the growth plate has not closed, there's that risk. Yes.
All right. So what would be your concluding thoughts regarding this Sever's disease? What you really want us to know when it comes to this particular ailment?
This is a self-limiting condition, and it is treatable, and it does not cause problems in future. It happens because they are at a point of a rapid growth, and the growth plate is beginning to close, and that is what causes that pull. The pull at that point is what causes the pain, and it's possible to not do operation for it once you've ruled out any other thing and you've focused that it's Sever's disease, and can be treated by good rehabilitation, stretching, and actually where they can resume normal life.
All right. All right. Thank you. Thank you for sharing that. And if you are joining us right now, tonight we were talking about Sever's disease, also known as that name.
Calcaneal.
Calcaneal.
Apophysitis.
Apophysitis.
Exactly.
Wow. Now, I'm learning some of these terms,
Yes.
but the simpler one is Sever's disease, especially for children between the age of 8 and 14. Thank you, Daktari, for enlightening us. Now we go to the questions that are being sent. That's by sending your message to 20933, WhatsApp on 0717400555. You can also catch us live on Facebook as well as on YouTube. Yes, technology has helped us. If you can read here on live on Facebook as well as on YouTube. You can see Daktari and I there. All right, let's see some of the questions coming. There's one here from a listener who says, I am 43 years old. I've been experiencing stiffness in the back and neck since last year. I did a blood test for arthritis and was told it's negative. Should I go for x-ray or which test should I go for?
Thank you for the question. So back pain or neck pain was various things. One, it can either be the muscle that has a problem. It can be the joint itself within the vertebra, the joints within the spine. It could be the bones themselves. So this all can be a source of pain, either at the neck or at the back itself. So one thing that happens, it happens with how we lift things, how we sit at the office, how we push things. That actually pushes the body. If you don't lift or push or put it in the right way or sit in the right way, generally what happens is now the back begins to have pain. And so that is what will be good. So pain that has lasted beyond 6 weeks, despite physiotherapy, because what is actually initially when you see a patient with back pain, first you have to make sure we rule out if there are any red flags. So we check if there's any infection, if there's any weakness or numbness, because he's complaining of neck pain or back pain. If there's any weakness of the hand, it could be either something that's compressing the nerve. If there's any weakness of the leg, you can think it's something that's compressing the nerve itself that goes to the foot. And so once that, or it could be a fracture of something that's very subtle that was not recognized. So the fact that he's complaining of pain, it would be good to know whether was there any form of painkillers that were given. What is that form of pain? Is it at night? Is it during the day? Is it accompanied by fever? Or was there any injury that happened? So beyond 6 weeks, then they have finished. They have done rehabilitation as prescribed by the doctor. It would be good to have an X-ray, but first it would be good, considering that what he says that it was test for arthritis that was done and maybe nothing else. It would be good probably to be seen and just get a further history and examination, for examination further before doing the X-ray. Yes.
All right. Thank you for that. And then we carry on now. Look at yet another question from our listener here, and saying, Daktari, getting you well. What's the best remedy for heel spa? Heel spa. Probably you can give direction regarding that.
Thank you. So heel spa actually is like the calcaneal pain in adults. So it happens the age of around late 30, going on to 60. So heel spa occurs in adults, where the back of the heel, there's an attachment of the muscle of the tendon that's called the Achilles heel, the Achilles tendon, and below it is called the plantar fascia. That is what helps keep the foot tight. And so in that point, risk factors is either putting very flat shoes, or if you've gained a bit of weight, what happens is that there's pressure at that point, and there's it's called micro tears that actually occur at the tip of the calcaneus. So the micro tears occur and the body heals itself. By that, it actually heals with some bit of bone formation. And what happens is that's what is now called a spar. It's because of the chronic healing and chronic tear and healing. And so what it occurs, it's like a spike of bone on the heel, and that's why it's called a calcaneal spar.
Mm-hmm.
So usually the treatment first, it will be stretching exercises, because what you need to do is treat not the cause, but not treat the spar itself, not the symptom, but treat what is causing that. So we examine and see if there's nothing wrong. We teach on stretching exercises of the heel and it's called the plantar fascia.
Mm-hmm.
That does not in itself get rid of that spar, but it helps in terms of relieving pain and being able to have strength. So it's not the spar itself that causes the pain. It's because of the constant healing, tear and healing, and it forms like a bone deposition, and that's why it's protruding.
Mm-hmm.
And so at the worst case scenario, it's resected. If it's constantly pain, you've done the active phase of physio, medication, strengthening, and there's still pain, and you're able to locate that it's at that point that's causing the pain, then we think of removal. Yes.
Wow, that's now surgery.
Yes.
All right. Thank you. Thank you for that, Dr. Harry. Well, in case you're joining us right now, we are live on Facebook as well as on YouTube tonight, talking about the health of your bones. I have with me Dr. Philemon Nyambati from AIC Cure International. Elizabeth, the JODM, getting you well right there on Facebook. I've seen you. Joseph Gitahiwa Pipeline getting us well from Karura Garage in Buruburu. Well, let's carry on. Another one here asking, what are the symptoms of arthritis? I have this pain for nearly a year now. Upper right arm discomfort. That's what this listener would like to know. Yeah.
So arthritis happens because of wear and tear, because of, just think about equivalent of a tire wearing down or a shoe wearing down. And so that overuse just our normal lives, it's just that some people are prone to getting wearing down early on as opposed to others, because it mainly happens from actually 40 to over, at least above 40, there's a possibility of someone having some form of pain. Mm-hmm. The person talked about upper arm pain. First, it's good to know that pain can be caused by many things. It could be referred pain, that is pain from another place. Either it's the disc that's on the neck itself. There are nerves that come from the spine itself that go to the hand. And so if there's a disc that compresses that nerve, it can cause upper arm pain. You can have pain within the joint. So osteoarthritis is pain within the joint itself, which now causes difficulty in moving or lifting. It could also be the muscles themselves, the muscles that move the joint, either at the shoulder level, at the elbow level, at the wrist level, at the finger level. And so someone, like, let's say if it's at the shoulder, someone may complain of pain, like they are trying to reach out into the top shelf and they are having pain like they can't reach. And so all those, it's called tendinitis, rotator cuff. These are the muscles that cross the shoulder that enable you to lift up. And so with the arm pain, you can have pain from that can radiate to the arm itself on the anterior part of the arm. And so it will be good to know. So it couldn't be arthritis. There could be other factors, and so we have to really think wide out of the box and see the person and just examine: is it the joint? Is it the muscle? Is it any neck pain? Is there any referred pain like tingling or numbness? Mm-hmm. And that's what would help us in diagnosing. So in terms of arthritis, it would be hard to say if it's that specifically. Yes, for arthritis, you'll mainly do an X-ray and check if there's any bit of wear within the joint itself, is at the shoulder, at the elbow. That can be arthritis. Yes.
All right. Thank you for clarifying that. And we carry on with yet another question here. This one is from a listener who wants to get a bit of clarification. What is the difference between joint pain and muscle pain, and what is the treatment?
So, joint is whereby they're it's like at the corner of two bones. Like you have the thigh bone and you have the shin bone. So we call it the tibia, shin bone, thigh bone, femur. So between that, that's a joint. So anything within there, or between the shoulder, or on the elbow, or on the hip, whereby you're able to move, that's joint pain. So muscle pain is, how can I put it? It's muscle that, I'm trying to describe muscle without saying muscle.
Yeah.
It's like the locomotive action. It's tissue that helps us to now move the joint itself. So it tends to span or cross the joint, like a joint. Like let's say there's a muscle that comes above the hip to the knee. That is what helps now pull the knee up, pull the hip up. Yes, so muscle pain is probably might feel sore at that point. It doesn't happen at the joint, or just happens at the substance. So between like in the thigh bone, there's the muscle that in front, like you might have pain in the middle. So that might be more muscle pain. And so there could be a number of factors that can cause that. It's not only injury that can cause muscle pain or joint pain. It could also be overuse. It could also be a symptom of either an infection that can happen and presents with either muscle pain, weakness, or fatigue or joint pains. Like malaria can actually also present as that. And so we look at it in a wide perspective in terms of joint pain, muscle pain. Yes, it's not limited only to orthopedics, but it could also be a symptom of something else.
Yes.
Yes.
And so it means that, as you've said, it could be a symptom of something else, or a situation that has been caused by overuse of the joint. So,
yes, or injury.
Yes. So it means somebody can, how can then a person receive the treatment that they need? Is it now a matter of the person getting treatment for the joint pains, or the situation that they're suffering from? Yeah.
Thank you. So what actually we do is make sure that we get, when the person comes to either the clinic or the hospital or the health facility, we get a history. We get to know, is there any injury that happened? Is there any problem or stiffness that they're unable to walk? Is there any fever? Is there any history of travel to a certain place? And then we now narrow down. So once probably you've done a blood test and it's negative for any other problem, because it could be even a cough that can actually present with like an upper respiratory infection, can present actually with muscle pain or joint pain. Malaria can also present with muscle pain or joint pain. So once you've ruled that out based on the clinical history and physical exam, now we narrow it down. So if it's they are actually complaining of pain and they're unable to move that joint, then you'll think probably that there's an injury at that point. Then we now narrow it to check, feel, move. Is there any swelling within the joint? Is there any inability? They are guarding, they don't want you to move that joint itself. And so that now is what guides us to treat the joint pain. If there's any muscle, when you touch it, is it that they're having a lot of pain? And is it a specific muscle itself? And so that's how we come to treating the specific tendon, muscle or joint. Yes, before, but we have to make sure we are wide just to rule out that there's no infection, there's no injury that happened, yes. And also we think of the age, which could be a side effect of some drugs.
Yeah.
Yes. Yes.
Thank you for clarifying that. I see a number of you already on Facebook and YouTube there. Annette Kagudi watching on YouTube and learning a lot from Daktari, tuned in from Nairobi. Morris Uwerengai Nyongesa, I've seen you from Wamuchanja in Cabras. Wow, thank you. Thank you for your company right there. Let's look at another question, Daktari, here. And this one is from Perusi Okonda. You're joining us from Germany. Wow, saying thank you for the program. It really uplifts me so much. Thank you for your kind words. And you say, I have a question about bones. Is it okay to take supplements like iron, zinc, and vitamin C or and D? Because during winter we never have any sun, and the joints start paining. There's that joint pain. And saying, I would be happy to hear from Daktari what he would like to tell us regarding that.
Thank you. So the difference that we're in the equator, so we have sun most of the time of the year. And so in cold countries, yes, there's not enough exposure to sunlight, which is a source of vitamin D. And so taking of supplements is okay. But if you can get it from diet, that's actually better. But it does not negate taking supplements if you're not able to get that from diet. What can happen actually probably in winter or in cold weather, the atmospheric pressure outside is lower than within the joint, and what actually now causes a contraction at that point and causes pain in the joints. So it's not for most people think that it's cold that causes arthritis, but it's just because of that change in atmospheric pressure, and some people are prone to it than actually other people. This happens especially if that joint space is smaller or narrower. So in terms of taking supplements, it will not be against it, but if you can get it from diet, that's okay. Yes.
That's you would say the best option?
Yes.
All right. Thank you. Let's check more questions here. This one is from a listener. The name is Irene. Irene says, good evening. Good evening to you. They say, I am 62 on meds for low bone density. Recently, I have developed pain in the ankles, heels, and feet. It's very difficult to walk. Pain meds not helping. How can you assist our sister Irene here?
Yes, so thank you for the question. And so low bone density, what happens with their hormones change, and so you're more likely to lose calcium as opposed to getting it. And so with that, it causes the bone density to be low. And that can be actually a source of pain. So with the pain that she's talking about, it will be good to just check, is it the plantar fasciitis? Is there any weight that she's gained that is causing pressure onto the joint? Is there any form of physiotherapy that she has done? Because that's what can help. Not only painkillers. Painkillers is the first form of treatment and rest initially. Then we now gradually stretch the muscle of the Achilles muscle and the plantar fascia, that muscles of the foot, and also the proprioception exercises, how you position the ankle or ankle strengthening exercises, what is given to help with the pain. If that does not, it will be good just to have further imaging based on the health professional, just to check. Maybe it's an x-ray that there's something that is missing. Maybe it's the foot itself having arthritis or the ankle itself. So that is that's the standard that I will go in terms of what she's saying, because she's reported that painkillers do not help. So it will be good to know, are there any exercises that were shown to strengthen, because pain is a function, is a component. There's a muscle element, there's a joint element, there's the bone element. So those are the things. It will be good to also know, how is the bone density? Because also low bone density can be a source of pain. And so is the medication optimized? how is the calcium level, how is the bone mineral density, that scan that has been done, does it show that it's optimal? Yes. So it would be good to let her be seen by a physician or the health professionals just to get to know further why or what's happening. Yes.
All right. I appreciate that as well. And in case you're joining us right now, we are live on Facebook as well as on YouTube, carrying on with this conversation revolving around the health of our bones. Dr. Philemon Nyambati is with us tonight. Let's now check another here that has come through. This is from Samdora Obat. You're joining us from Siaya County. Say thank you very much for the informative conversation. God bless you. Thank you for your kind words.
Amen.
And also for listening in. Well, I have another question here. This is from saying thanks for answering my question about joint and muscle pain. I have had this discomfort on my right upper arm for over 1 year. For over 1 year, I am 52, and saying, how is onset of arthritis when it comes to joint and muscle pain? Yeah.
How the onset of arthritis? Okay. Okay. So one thing about for some people it occurs early, for some people it occurs late. So for some it can be as early as 40, for some it can be as late as 60. So that is the age range that is most likely affected. And so when you talked about joint pain or onset of arthritis, what you might have is probably, with arthritis, what can happen is it's inflammation of the joint. And so it happens whereby what happens is someone might have swelling of the joint itself. There might be heat at that point when you touch it. There's pain even on moving and stiffness. So initially what can be is maybe you can have joint pain that comes on and off. When you do activity initially, you might have just some little pain. But with the time, probably you're not even able to do that activity. That's when we think about onset of arthritis. At least you might say it might take a period of 2 weeks, it could be 6 weeks. So if there's no relief by medication or based on x-ray, if you can see that there are changes, then we can think that it could be arthritis. I think that's what I can say in terms of trying to answer his question. Because onset, usually duration, you might say a period of at least a period of 6 weeks. But this is as a result of what is happening over the years. So this symptom of arthritis, it's not that it happens like pap. It's because of what has been happening throughout the year. Throughout the years, rather. Yes.
Okay. Thank you for that. Another one here has a question for us. And the question goes something like this. I'm saying, first of all, good evening to you, Jackton and Dr. Nyambati. Good evening to you.
Good evening.
Yes, saying I am 59 years old and got an accident 10 years ago, which gave me multiple compressional fractures of my back. I love gardening, especially hoeing. Occasionally, it gives me lower back pain. Am I doing any harm to my bones? This is from Mrs. Bosire.
Thank you, Mrs. Bosire. So, thinking about is actually good because this is a form of activity that someone can love. It just helps you move around if you're not very active. It will be good just to know how long is that, because you do not want to, or a rake that you're using, we don't want to bend excessively. You actually have to make sure that at least you're in a bit of an upright position. I know how we were taught by our mothers, grandmothers, is when you're mopping the floor, you're bending or you're washing the clothes. But actually what you need is actually proper ergonomics of the back. And so it will be good to, if you're bending too much in terms of hoeing, actually that can be a risk factor for causing back pain. And then considering that there was obvious injury that caused multiple compression fractures, it actually predisposes you to more pain. What actually is recommended is either having a longer, longer stick for the hoe, just to help in terms of hoeing or raking when you're doing the gardening. And also, it will be good also one thing to strengthen, to have core or back strengthening exercise. So core muscles are the muscles on the abdomen in front on the tummy, and the back muscles. It's good to have back stretching even after you bend or after doing the gardening or any form of activity. So that helps strengthen and reduces the risk of having back pain. Yes.
Mm-hmm. All right, that helps. I also have another question here. This is from Dosila. Dosila says, thanks for this discussion. What causes pain on the right knee that you only feel when you're climbing stairs, and it makes the sound that you feel affecting the neck? That's what she's asking here.
Yeah. Okay. Mm-hmm. Thank you. Mm-hmm. I will say those could be probably two things. There could be pain at the neck itself, and there could also be pain at that she talks about the knee. Mm-hmm. So what happens is as we are aging, or as we are going between 30, 40, our ligaments and our tendons are changing. And so what happens is there's the muscle that's anterior thigh. It's called the quadriceps. It's a muscle that attaches onto the heel, onto the kneecap, and then goes all the way to the shin bone. And so what happens is with the time it tends to thin out, especially if you're just not doing a lot of exercises to help strengthen it. And so with the time what can happen is there might be pain on the anterior part of the knee that will happen when going up the stairs or going down the stairs. So because that when you're going down the stairs, there's the resistive force that actually your body is resisting you in terms of as you're going down, so that you don't trip over. And so it's called tendinitis. So that where the tendon or where that muscle attaches to the bone, it's actually the lying tissue is called a tendon. So at that point, it might have some bit of micro tear and cause pain. So that can be tendinitis. The clicking, you can have clicks on the joint. This happens when air bubbles are trapped within the joint for some reason. And so if it's painless, like when people snap their finger, not snap, but break their fingers, like I just did, something like that. Yeah. So that is because where air bubble is trapped. And so when the joint, when you flex, when you bend the joint, it pops. So or it clicks. And so if clicking of the joint, if it's painless, that's okay. But if there's a certain pain, or the clicking causing pain and inability to move, or the stiffness, then it will be good to examine. Is it the cushions within the knee itself? There's what is called meniscus. It's a cushion within that helps you move. Is it trapped somewhere? Is there any form of tissue within the joint that's causing this pain? And that is what I'll think about. But based on her explanation, I would think it's a form of tendinitis that she has. Mm-hmm. And mainly treatment for that is actually physiotherapy and medication. We will need to actually stretch that, the quadriceps is what is called the quadriceps joint, the quadriceps muscle. So you need to stretch it. Then we show strengthening exercises. In terms of the neck pain, there are a number of things can cause neck pain based on our ergonomics, how we sit, how we look at the phones. We are really prone at looking down, and that actually puts a stress on the neck. Wow. Or watching the television, or doing sitting and doing on the computer. It could be probably that is what is causing the pain. It could be either the muscle itself, it could be the disc itself, or at the that's attaching onto the bones. Usually it will be good to be examined and just to see what could be the source of this, and probably they might do an x-ray if it's persisted for long, and further imaging. but treatment is actually the exercises for stretching the neck and strengthening exercises of the neck. Yes, they look like they're two different things, I would say. Yes.
All right. Thank you for clarifying that for the sake of the listener.
Yes.
And another one here, this is from David. David is asking this question. Why does rheumatoid arthritis have skin manifestation, especially for sicklers? That's what David is asking here.
So, from the that I could remember, size of the carries blood, oxygen, the red blood cell that carries oxygen is in a different shape, or a C shape or a sickle shape, and so there's not enough oxygen that is carried onto various areas, and it can manifest as either swelling or pain or joint pain. That's what can happen. So in rheumatoid arthritis, is different from osteoarthritis, because osteoarthritis happens because of wear and tear. Rheumatoid arthritis is whereby it's called an autoimmune disease. So the normal cells of the joints are attacked by the body itself, and that's why it manifests as pain, swelling that comes on and off, and it can actually present with skin manifestations. It's because now the cells of the body are actually attacking areas of the joint, and it tends to be persistent for about 6 weeks for you to say that it's it's rheumatoid arthritis. In terms of whether rheumatoid arthritis and sickle cell associated, I will not in a position to say as per now, but the best would be actually to have a rheumatologist and a hematologist to see because of the sickle cell, and a rheumatologist who can check, because usually the treatment is some form of suppressive therapy to just help modulate the cells, because these are the immune cells that actually are attacking the joint, which presents with pain, and for some they have inflammation and skin changes. Yes.
All right. Thank you for that. Let's check another one here. This one is from a listener, Miss Kabugara, and you say, what causes lockjaw and numbness like on your fingers? It comes and it goes. Not recently though. Once again, what causes lockjaw and numbness like on your fingers? It comes and goes.
So for numbness of fingers, it could be a manifestation of various things. So the feeling of numbness is, so our bodies are designed to feel, like when you touch something you actually feel, and this is because of what we call nerves. So nerves actually come from the so you have the brain itself and the spinal cord. So in the spinal cord itself, there are nerves that come out from the vertebral canal going into various areas. That's what helps you feel when you're feeling hot. That's what makes you get away from fire in case you're pricked, in case you want to reach out onto something. So nerves help coordinate the body in terms of movement, in terms of strength, in terms of when you're feeling pain. And so there are various nerves in the upper limbs, in the lower limbs, that help with the movement. And so I would think that either it's there could be from the neck itself, either it's a disc within the neck, or it's called the cervical spine, where the bones or the bones of the neck help you turn your head round. And so between the two bones, there's what is called the disc. So if it's compressed, it can actually cause numbness of the fingers. Or it could also be just the nerves that are not necessarily from the neck itself, also within where a nerve passes. There could be a swelling within the hand or in the forearm that actually is causing the numbness. So it would be just good to have just a proper examination and just to know what is it. It could also be some wrist pain. There's some form of wrist. There's what is called carpal tunnel that can actually happen, whereby you have swelling on the wrist itself where the nerve passes through, and that can actually cause numbness of the hand. Then for the lockjaw, it can happen in mainly because of altered culture, and that is what actually can cause a lockjaw, or in a patient who sustains tetanus, and so that can actually be a cause of lockjaw. Yes. In terms of whether it would be good actually to see a physician and just to know why it happened. Yes.
All right. Thank you. Thank you so much, Daktari. I think we have, that's the time we've been allowed tonight to look at those questions pertaining to the health of our bones. And so grateful to Daktari for gracing us with your presence and answering those questions. Now we are learning. We are now better in terms of getting to know what Sever's disease is, and all the other conditions that have been mentioned tonight, helping out with that. Probably you have your parting shot you'd like to share with us before we conclude this session.
I had fun facts from the Bible. Actually, the number of things.
Yes.
We hear about the heel in Genesis chapter 3, verse 15. When Adam and Eve said, the snake bite your heel, and it shall strike its head. David, in Psalms chapter 41, verse 9, even my close friend who ate my bread has lifted his heel against me. He's talked about, being a traitor. Jesus himself too, when he was washing the disciples' feet, he just said that prophecy was actually fulfilled. He also who ate my bread has lifted his heel against me. So it's just something to know that God is faithful. And one thing is that it's a treatable condition because of calcaneal apophysitis or Sever's disease. And I would like to thank you for this opportunity to just give me the platform to educate the viewers and the listeners on this condition.
All right.
Thank you.
You're welcome. In case somebody would like to get in touch with AIC Cure, they can get us. How can they get them?
So the website is www.curekenya.org. We have the Cure Nairobi Clinic, which is in Westlands. The number is 0733 790 421. I'll repeat again, 0733 790 421. We open from 8 to 5. On Monday to Friday. Yes.
All right. Thank you so much. You say hi to our friends there at ASTQ, and we pray that God will rejuvenate you and strengthen you as well.
Amen.
Amen. Well, that's just about it in this hour where we were discussing matters to do with the health of our bones. And tonight we were hosting Dr. Philemon Nyambati from AICQ International in Kijabe. Have yourself a wonderful evening, and thank you for listening.
Breath of Heaven.